Fidmi Medical, making a pathway to better health. Some people who have suffered a stroke, who have Parkinson's or dementia, or who have a neurological impairment may be unable to take food orally. Enteral feeding is a life-saving long-term solution where the patient is fed through a tube inserted directly into the stomach. Feeding tubes are inserted during a procedure called percutaneous endoscopic gastrostomy, or PEG. Globally, more than 1.3 million people depend on enteral feeding. However, tubes require replacement. More than 4 million tubes are used annually. Tubes clog, dislodge, and degrade. In fact, many physicians recommend replacing the initial tube within 6 to 8 months. Even with replacement tubes, complications persist, and replacing tubes as often as every 3 months places a substantial emotional and financial burden on patients, caregivers, and the healthcare system. Fidmi Medical introduces a specially designed low-profile enteral feeding device. The device is inserted in a standard PEG procedure. Special design features eliminate the need for repeat replacement. The rigid core internal bumper combines flexibility with structure. Designed to stay in place from day one, it reduces the risk of accidental dislodgement and prevents stoma injury. The disposable feeding tube insert can be easily replaced by the patient or caregiver as often as necessary. It reduces clogs and lets food and medications flow freely. The uniquely designed external bolster stabilizes the device, keeps the stoma site clean and ventilated, and adjusts to changes in position. When removal of the device is necessary, the internal bumper breaks apart into small pieces that are expelled naturally for trauma-free removal. The low-profile enteral feeding device, developed by Fidmi Medical, improves quality of life, increases caregiver satisfaction, and reduces healthcare costs. Fidmi Medical, making a pathway to better health.